Over 1 million patients could avoid arrest for cannabis with CanCard. From today, patients with a multitude of health conditions will have the right to apply for a CanCard. The card, which is backed by the police commissioners, communicates to police officers that a person should not be arrested for consuming self-sourced, illegal cannabis as a medicine. Up to 1.1 million people could be eligible for the CanCard by 2021, removing the fear of arrest and prosecution for possession. All patients with a health condition that is currently being privately prescribed at a high cost will be eligible for the card. Police forces nationwide will receive a briefing pack from the National Police Chiefs Council, and all expert witnesses who testify on their behalf of the prosecution in court will be trained on the scheme. The card was the brainchild of Carly Barton, who, despite living in chronic pain and a seizure-like dystonic episode, has been at the forefront of patient advocacy in the cannabis space since she became the first patient in the UK to obtain a private prescription. She could not afford to sustain the cost of her private prescription, however, and returned to using illicit cannabis, thus inspiring the CanCard initiative. Miss Barton has been a prominent advocate for law reform in this area and worked tirelessly to bring together the police, MPs, doctors and patients to collaboratively design a scheme that effectively decriminalises cannabis for over 1 million patients in the UK. In its design and implementation, CanCard has a working group that extends to representatives from other areas: the Police Federation, the National Police Chiefs Council, the Police Foundation, and the Drug Expert Witness Board. Police officers who encounter a patient in possession will be able to contact the policing helpline to verify the patient is genuine. Miss Barton said, "We all know that cases where patients are proved legitimate are unlikely to make it to court, and if they do, these cases are consistently dropped. This is especially the case when a patient presents with a condition that is being privately prescribed for. There is currently no way of identifying these people before emotional distress has been caused and public resources have been wasted. There is an opportunity to provide something that changes this by way of providing a service that benefits both patient and police. CanCard should give patients peace of mind and the police confidence in using their discretion before any stress has been caused to vulnerable people. Without a law change, we have national guidance and discretion with which we build a solution. Both have huge parts in the design of CanCard. Having the police on board with the design and implementation of this has been essential to making the project plausible. The patient will also be able to use RFID, like those found on a debit card, to scan the card on their phone and confirm their ID to the police officers. This is the first move in the UK towards giving police the tools and the confidence to use their discretion for possession of illegal substances. It also is the first scheme that sees grassroots campaigners collaborate on such scale with law enforcement, health professionals and policymakers.